The following segment is sponsored by Munson Healthcare.
These past several months have been a long stretch of staying home, communicating with loved ones from a distance, and wearing masks when we go out in public, all in a critical effort to flatten the COVID-19 curve. Now that warm summer days are here, some people might be growing weary of taking such strict safety measures. It could be tempting to lower our guard and ease up on precautions like masking. But many of our hospitals are reporting a recent increase in positive COVID-19 cases. This is concerning, and it's never been more important to remain cautious and continue our efforts against COVID-19. I'm Dr. Christine Nefsey, and today we're answering your questions about COVID-19 precautions, specifically masking, with the help of Munson Healthcare's Interim Chief Quality and Safety Officer, Dr. Joe Santangelo.
At Munson Healthcare, we get a lot of questions about masks. When to wear a mask, how to wear a mask, and why to wear a mask. You'll see I'm not wearing a mask right now, and that's okay because I'm outside and I'm not within 6 feet of anyone else who doesn't live in my household. If you're within 6 feet of anyone who doesn't live in your household, you should be wearing a mask. And there are lots of good studies that tell us that masks not only protect the people around us, but do offer some protection to people who are wearing the mask as well. The most important reason to wear a mask is that we know that COVID-19 is spread by respiratory droplets. So when you cough or sneeze, or even if you talk very loud, there are little droplets of COVID-19 that can be spread. By wearing a mask, you can prevent the spread of those droplets to other people. So if we all wore masks, we could dramatically reduce the spread of COVID-19. Whenever you put on or take off a mask, try not to touch the front of the mask, but use the ear loops or the ties to put the mask on. Now, you often have to adjust the mask by touching the front, and every time you touch the front of your mask, you should make sure that you use hand sanitizer to clean your hands afterwards. That goes for when you take your mask off as well, and if you're going to be storing your mask, store it in a paper bag or even on the dashboard of your car to allow it to air out and stay dry.
Thank you, Dr. Santangelo. On behalf of Munson Healthcare, we want to thank you, our communities, for continuing to wear your masks, keeping a safe distance from others, and practicing other safety measures like frequent hand washing. These are the steps we can all take to slow the spread of COVID-19 this summer and beyond. For more information on the do's and don'ts of masking, visit munsonhealthcare.org/masking.